cupping? So raise your hand if you've had cupping. You've had cupping? Okay.
I've had the other
That on your,
yeah, but not the dry.
Okay, yeah. Okay, so cupping is awesome. It's amazing. So we're going to talk about the history of cupping first. So cupping is first documented in an Egyptian medical paper dated back to 1550 BC, which is 3,500 years ago. So it's a very old practice, as you can see. Most of cupping back then was a form of bloodletting, where the skin is pierced so that the vacuum will draw out blood from a local area. This is not the kind of cupping we do here. Dry cupping that has no blood. Well, there's blood involved, but it's under the surface of the skin. The kind we do here at Restore is mentioned as well, but to a lesser degree. Cupping appears next in writings from Greece around 400 BC. Hippocrates, the father of medicine, was an advocate of cupping therapy. So it started to spread globally through trade partners in the world. In China, it was written about in a handbook called Prescriptions for Emergencies. So it was, medical, like here it's kind of like therapeutic now, but back then it was like part of medicine. In the Arab world, cupping was recommended by Prophet Muhammad, as well as many famous physicians. In those days, cupping was usually used to remove bad blood and restore the blood to a more purified and disease-free state. Cupping therapy continued to move with trade to every other country in the world and was practiced broadly in Europe and Asia before immigrants and doctors brought it to the New World. Cupping was used for many different things throughout the ages. In Egypt, cupping was used to cure sores and poisonous animal bites by removing foreign matter from the body using a combination of bloodletting and suction. In Chinese medicine, cupping was used for many ailments, specifically for its abilities to move blood and qi. And Greek medicine used it to restore fluid metabolism, which is processes affecting digestion, respiration, and the kidneys. In Arabic and Islamic literature, cupping was not only used to treat disease, but also as a preventative measure. And Europeans used the technique to treat things like gout, chest, and sinus infections, and to facilitate delivery during difficult births and aches and pains. Okay, so before cupping was used, as you said, as like a form of bloodletting, pulling out the bad stuff, like it said, poison and stuff like that. Now it's different than that. If we're still pulling the blood to the surface of the skin with suction, so it's like negative pressure. It's just that we're not pulling it out of the body. We're kind of getting it unstuck from a tense muscle or connective tissue, and then the lymph system is going to clear that out. So it's kind of a similar idea, but not poking holes. Okay, so what is cupping? Cupping therapy can also be called myofascial decompression. So fascia is a thin, fibrous connective tissue that supports every structure in the body. It is the tissue surrounding all cells, nerves, joints, tendons, ligaments, organs, muscles, and bones. It is a system-wide network that provides form and function to every part of your body. This continuous layer of tissue is the reason why we say everything is connected, from your toes to your fingertips to the crown of your head. So like if you think about reflexology, they're massaging your feet and they say, okay, this point right here is for your spleen, or this is for your shoulders, And that's why it was saying like how it can affect digestion. Like you would think, how does this one little section on my skin affect all these internal processes? But that's because of the fascia that goes in and around all your organs. Fascia is made up of mostly collagen that provides strength, flexibility, joint stability, movement, and a pathway for circulation, which that is a very key thing, is the circulation. Because if it's tight, then circulation is being inhibited. It creates an environment that enables all your body systems to work together. When your fascia tightens, it can restrict the movement of your muscles and tissues, causing muscular tension, pain, and other health conditions like decreased circulation. Cupping uses negative pressure to lift the fascia, creating space in the tissues for blood flow and circulation, allowing underlying tight muscles to relax and kind of become hydrated and cleaned out. Historically, cups were made from available materials like hollowed out gourds, animal horns, and bamboo. Then they progressed to metal, glass, and ceramic. Because of the rigid nature of these materials, creating a vacuum inside the cup was difficult, which is why fire was used. Today, thank goodness, we have more complex manufacturing methods, so pumps and valves are used to pull the air out of the cups to create a vacuum and maintain a seal. The cups used today are usually made out of silicone or plastic. Some practitioners do still use fire, but it is less common because of the danger and risk associated. I prefer the valves, personally. Okay, so indications for cupping. So all the practitioners know indications. Indication is like a reason why cupping would be good, or as something, that is bothering you that cupping would be beneficial for. So cupping can have therapeutic effects for many ailments. Mostly it provides a decrease in a person's perception of pain and disability and increases in range of motion when there is a restriction present. Some of the conditions treated by cupping are arthritic conditions like, this was a very specific one, I'm going to try to say it, ankylosing spondylitis, which is basically arthritis of the spine. Okay. Oh my gosh, what are the odds? I'm not happy that you have it.
You pretty much got all those. So,
yeah.
I do have that. Yeah.
Yeah. So, if you think about it, if you put cups down along the spine, it's pulling the connective tissue, so it's going to stretch in the spine and allow blood flow and lymph fluid to flow. Entrapment syndromes like nerve compression, so that would be like where a muscle is tight and it's pushing on like what sciatica can be. General pain, heel pain, low back pain, neck pain, shoulder pain, tight muscles and trigger points, stress, congestion, a sluggish lymph system, colds, sinus infections, cellulite, and wrinkles. So some of these are outside of the scope of massage therapy. But like wrinkles, sinus infections, colds, although I have had people say that they felt congested and then the cups on their back made them kind of feel like loosened up.
You did that for me when you did cups.
Yes, I was trying to think about that. Yeah. So contraindications for cupping. So the contraindication is a condition or reason why a treatment should not be done on a person, usually because it would be unsafe for them. So we don't want to do it on a cut, a stab, a sore, even though they did that back in the old days. We don't do that anymore. We're not sucking anything out of the body. We're just bringing it to the surface. You don't want to put it on like where there is inflammation. If there is specific inflammation there, you don't want to put a cup on that spot. It can help a lot with inflammation. It's just like, say your ankle's really swollen. You don't want to put a cup on it and like create a vacuum. That would just further irritate the area. Areas where major blood vessels or nerves pass. And if you have to do it there, then you just want to do it for like a little bit less time. You don't want to put it over the eyes. I don't know why anyone would do that. Condition-specific contraindications are like active cancers. And this is a little morbid, but unless either in remission or terminal, and you're not, I think it's because of medication. Certain medications, any medication that's going to cause like blood clotting issues, you don't want, because the cut marks are actually a bruise. It is a bruise. So it's like you're bringing the blood to the surface and the capillaries are kind of bursting. If you have a pacemaker, you don't want to do it. If you have organ failure, hemophilia, or similar bleeding disorders. So blood disorders, we don't want to do cupping, I guess if you have low blood or high blood pressure and you're on blood pressure medicine, it's probably fine. And then caution about acute infections, anticoagulants, severe chronic disease, anemia, pregnancy. Obviously you can do it on a pregnant person, just not like on a pregnant belly, People who have recently given blood or undergone medical procedures, health conditions that impede neurological status or ability to perceive pain or communicate, diabetes, and compromised skin integrity. So like very crepey skin, people who have very delicate skin. It might be irritating. So then this is just cupping colors. So the marks made from the cups have different colors. So somebody who is very active and eats extremely healthy and drinks a lot of water, they're probably gonna have the marks at the top, that light color. And then stagnation is going to be the next two down, so either moderate or severe. So that could be like, say you have a chronic tight shoulder and your muscle has been stuck and like nothing has been flowing through there for a long time. It's like stuck old blood is in there and it hasn't been able to flow out, and new blood hasn't been able to flow in. So it's not necessarily toxins, it's just like stuck. That's a circulation issue. And then if it has little black dots or purple marks, that's toxins. So that could be like, I don't know, if you had a bunch of glasses of wine or, something like that, or if you eat a lot of junk food or, toxins come from all over, even from inside of our bodies. Toxins are produced. And then key and blood deficiency. So that is basically like, I find this a lot in like elderly people, Key is energy. So that's like kind of like very Western or Eastern. Sorry, Eastern. So that's like energy levels. If you don't have high, kind of like prana.
Reiki.
Yes.
That's
yes.
what it is.
Yes.
That's exactly what it is.
So stagnation is the blood is not flowing or circulating as optimally as it could to all parts of the body, causing pain. Toxins are substances in the body that are inhaled, ingested, absorbed, or created internally through cellular processes that would normally be flushed out through the lymph system, key circulating life force energy, and blood deficiency, not enough healthy blood cells, which is usually anemia of some kind. Okay, do we have any questions? No questions. Okay, yeah, so I think the main things about cupping to keep in mind are that sometimes we think of a tight muscle, but really it can be the connective tissue. So it's not just one muscle here, one muscle there. It's like the whole sheet is just so tight, And so cupping is gonna kind of create a vacuum and Bethany, will you get me the cupping set? Will you get me the cupping set?
Is it in the closet?
Yeah. I forgot the most important part.
Is it painful? I mean, is there any Like, does it hurt?
So I personally think it feels amazing.
Okay.
I think it kind of feels like a relieving of pressure.
Okay.
So it's like creating space in a place that's really stuck because we have fibrous connective tissue that goes in and around. It both separates and connects the muscles. So it can be like kind of like think about like a thank you. Think about like a vacuum sealed bag with clothes in it. You know, like you fold your clothes for winter and then you put them in that little bag and you suck out all the, and it like flattens. And that's kind of what can happen to your muscles. So this is like putting space back in so that everything can flow. And flow is important because that's how we clean our body, our tissues, how nutrients are delivered to our tissues, and just all the body's processes is through the connective tissue. Okay, so shall we do a demonstration? Okay, so I just gave Emil a massage, so it's perfect. So if you want to get on the table.
Yes. Okay. One grape. One grape.
One grape.
Just sugar, right?
Just
Oh.
yeah, just a little grape. Yeah, that's good. Okay, so this is our cupping set. Careful. Yeah, so this is our cupping set. So as you can see, there's different size cups. So this one would probably be good for like if you were like right here, or maybe somewhere in your neck, if you were having some specific pain, or even if you were having referred pain and it was like maybe your scalenes, a trigger point in your scalenes causing like a radiating pain. So then this would be good. I usually use the bigger cups, and we always do massaging first, but keep in mind I just gave him a full body massage 20 minutes ago, so we'll do just a little bit of that. So I know Emil has a lot of low back tension, so it would be, you know, I'm gonna feel where the tension is, and
You
then
can lower it if you need. Yeah, actually.
yeah.
Right here.
Yeah, so we're gonna feel where the tension is, which is, it's all over. It's all over with Emil.
I'm good demo.
Yeah, so like that.
True
Right.
experience.
But we're gonna focus a little bit on the low back because that's his focus area. That's his biggest chief complaint. So we start by massaging, which we already did. And then we're going to place the cups in the areas of tension. So there is a fascial sheath that is in your low back, and it's kind of, it's kind of in like a triangle, and I can really feel it. It's like the muscles going down this way and this way. So we're gonna try and get it on most of the tension. So you start with one, and then sometimes you can do sliding. So you can do just one little suction and kind of pull the area away, and it's really stuck there.